Mr. and Mrs. Anderson live in a big house at the end of our street. They used to be quite active in the neighborhood. They practically know everyone because they have lived here since the 1970s. We don't see them as much anymore. However, there was a time when you couldn't step out the front door without seeing Mr. Anderson tending to his garden or watering the grass. However, their yard isn't as beautiful as it once was. Mr. Anderson fell off a ladder and injured his hip last year, so his grandson comes over to cut the grass every couple of weeks. Last Christmas was the first time that I can remember that Mrs. Anderson didn't bring her famous batch of Christmas cookies to all the neighbors. It seems that their age is slowing them down, and they spend more time inside. They don't even sit on the porch that often. It appears that Mr. and Mrs. Anderson are becoming increasingly homebound. It is common that older adults become homebound due to illness, injury, or mobility issues. For them, life may not be as full and exciting as it once was. Yet, it is just as important for them to continue practicing healthy habits to take care of their body and mind. Being homebound does not mean that you cannot enjoy continued quality of life. However, homebound seniors and their families must stay focused and committed to their being active and engaged. In this video, we are going to suggest some tips that you or a loved one can use to stay happy and healthy at home. Let's use Mr. and Mrs. Anderson as an example. It might seem like a good idea to slow down as we get older and experience more aches and pains. But exercise is an important part of nearly everyone's everyday health, including older adults. Seniors should be as active as possible. Even for older adults, exercise can help us live a longer, healthier life. Avoid just sitting in the rocking chair all day. To keep moving improves your strength and helps you stay independent. Going for short walks can improve your balance and help you avoid falls. Staying active can prevent or delay diseases such as heart disease, diabetes, or osteoporosis. It also can improve your mood and fight off depression. If you ask your doctor, he or she will tell you that it is safe for most adults over 65 years old to exercise. Even people who have chronic illnesses can exercise safely. If you are not sure if exercise is safe for you or if you are currently inactive, ask your doctor. Taking small walks around the house or backyard and doing simple muscle exercises will keep your blood flowing and help you feel your best. An ideal way to determine the best level of exercise for you is to work with a physical therapist. Some people even qualify for sessions with a knowledgeable physical therapist in your own home. Eating should be fun. Enjoying meals improves your mood, and cooking can be a great outlet to keep you moving. If you are unable to shop or cook with ease, or it is difficult to enjoy nutritious meals, look up senior services in your local city or county, and they can connect you with a home delivery meals program. You will also need to consult with your doctor if you have issues that make it harder for you to eat healthy as you age. Some changes that can make it harder for you to eat healthy may include changes in your home life, such as suddenly living alone or having trouble getting around. You may not have the stamina to cook or feed yourself. Many people don't realize that certain medicines can change how food tastes, make your mouth dry, or even take away your appetite. Many homebound seniors do not have much money for food. Others have problems chewing or swallowing. It is important for homebound seniors to remain independent, but it is also important for families to have discussions and address any situations that may prevent healthy eating. Creating a comfortable routine is crucial for the health and well-being of homebound seniors. Whether they live alone, with a partner or family member, or with a caregiver, a daily routine can help anyone to sustain long-term health and happiness. Waking up, performing self-care, and taking your medicine at the same time every day can create a strong foundation for the rest of your day. Creating a consistent routine will also help you stick to healthy habits, such as daily walks for exercise and eating balanced meals. As we age, taking care of our minds is just as important as caring for our bodies. Older adults face an increased risk of developing neurological and mental health disorders such as dementia and depression. Actually, you can have fun boosting your brain health and reducing your risk of mental decline. Experts suggest that older adults can improve their chances of maintaining a healthy mind by getting plenty of sleep, learning new things, and staying socially engaged. Creative pursuits such as painting or drawing utilize a good portion of our brain. Working with puzzles and problem-solving activities such as crosswords and word searches are also beneficial because they help build recall memory and stimulate word association. Be sure to discuss any concerns with your healthcare provider and ask about specific lifestyle changes that can help your mind stay strong. Participating in activities that you enjoy and that stimulate your mind and memory will help you stay healthy at home. Aging can bring many stressors along with it, especially for seniors who are homebound. Therefore, it is important that you learn ways to reduce your stress levels. The loss of friends or family members, a change in relationships with children, or a decline of physical abilities can all lead to anxiety or stress. The good news is that there are many ways to counteract these problems from your home. Practicing some form of meditation, or even just taking time to relax, eases your stress response and can lower blood pressure, heart rate, and production of stress hormones. Spending time with family or close friends or watching light-hearted television programs in the middle of the day can be ways to find balance in your daily home life. Some individuals may also benefit from seeking professional mental help when it comes to managing chronic stress. It never hurts to talk to your doctor or mental health professional for additional insight on how to improve this facet of your health. Worldwide, tens of millions of people are completely or mostly homebound. Countless others have functional limitations that make it hard for them to leave their homes, even for their most basic needs. Many of these individuals have profound difficulty accessing regular medical care, and some are unable to do so altogether. As a result, many homebound people struggle to manage their illnesses and depend on family caregivers. When these adults experience a health crisis, the fortunate ones take an ambulance to the emergency department. Although these doctors and nurses mean well, they are typically unfamiliar with the conditions and care goals of their homebound patients. Once the homebound adults are discharged from hospital stays, they often experience little to no follow-up care. Healthcare use and costs are much higher in people with multiple chronic conditions and functional impairments. A significant portion of these patients are homebound. Aging is both natural and inevitable. Living your golden years should be embraced for the potential it holds. Therefore, it is so important to develop good health habits. That said, it's also important to recognize the changes and limitations involved in the aging process. The goal is to maintain a sense of independence for aging adults. For older adults, keeping a sense of empowerment and positivity intact often comes down to their ability to stay at home. But we cannot overlook the fact that many are trapped at home. It is the job of friends, family, and healthcare professionals to know where help is needed. We are pleased to have brought you another video embracing the art of undying. The tips and suggestions mentioned in this video are for general information purposes only and should not be construed as professional medical advice. If you are concerned about a family member being homebound, look in on them to ensure that you have a clear understanding of your situation from a physical and mental viewpoint. If there is a health or wellness subject you would like to know more about, leave us a comment and we'll be happy to put together a video.